Good afternoon. I welcome you warmly to Applied Medical Sociology class. Yes, it's my pleasure to have you here. I'm Ezekiel Oyetayo. Right. So today we'll be starting with a concept of medical sociology. Sociology in its context is a scientific study of social relations, institutions, and the society. So medical sociology is a scientific study of social patterning of health. That is how social factors like class, gender, race, ethnicity, religion, and so on and so forth influences human health. Okay, so what's now the relevance of medical sociology? Why are we learning medical sociology? Medical sociology is essential for understanding health disparities, healthcare access, and patient behavior. It also gives insight into why certain populations are more vulnerable to a particular disease and a population is not vulnerable. It also helps healthcare professionals, particularly nurses, to develop a deeper understanding of social background context of their patients, where they are coming from, so that they can give out perfect healthcare. All right. Then organization of the society. The An hospital, for example, is an example of the society. And every organization is structured in a specific way to enhance effectiveness. It shows hierarchy and it shows roles in order to enhance effectiveness in that particular organization. It's usually been illustrated as an organogram, and it shows role and it makes work more effective. Yes, now we have health and in-health behavior. This refers to those activities undertaken by a person believing himself or herself to be healthy for the purpose of preventing a disease or detecting it at an asymptomatic stage. So many actions can be displayed by an individual, which can be called health behaviors. Such include smoking, drinking, sleeping, physical diet. Okay, then we have human and social behavior. Every human behavior, according to sociologists, is influenced by a variety of social and cultural factors. So social behavior refers to how the individual interacts with the society, social norms, interactions, and the likes. And in the context of healthcare, understanding human and social behavior helps health professionals to predict how patients will interact with healthcare system, whether they will adhere to their treatment schedule or the decisions they will make about their health. For example, different people can take different actions when it comes to preventing cancer or any other illness condition. Would people stop bathing, sunbathing? Would people stop using salt water to bathe? Or would people use condom, for example, to prevent getting HIV infection? Then we have social institutions. It's important to understand that the social institutions we are talking about includes the family, the religious sector, political sector, and the society at large. For example, family as a social institution, the family provide for the sick member of the family, while education as a social institution promotes health literacy. Okay, then we have contemporary social problems, which includes poverty, inequality, drug addiction, homelessness. Okay, so such problems interferes with the smooth running of the society. And definitely, when there's a problem like this, it throws the society into disequilibrium. All right. Then some of these social and cultural factors we are referring to are is what we have here with us. Social factors arises from interactions among individuals or groups in the community. Okay, then for example, the lifestyle in an urban sector, Lagos, for example, health issues that people there might possibly be having will be stress related illnesses compared to people who live a simple life in a rural area. Okay, then we have the cultural factors too, which includes beliefs, traditions, and values. Okay, well, we have the religious factors too. We have religions, we have some cultural beliefs that does not allow people that practice them to take family planning for their children, family planning to prevent unwanted pregnancy. Some don't allow their children to get immunized against certain diseases. So these are some of the beliefs and the factors that it must be understood as a medical practitioner to help you to deliver your services effectively. The nuclear and the extended family also plays a great role in this. The nuclear for example, the parents are the ones that will make major healthcare decisions. While in an extended family, the grandparents will be involved, the uncle, the aunt will be involved, unlike what it is in the nuclear family setting. Okay, then marriages, the different type of marriages, either polygamy, monogamy, will also determine some roles, some decisions that will be made. Okay, then divorce too. Divorce can lead to social and physiological stress. So as a medical practitioner, if you understand from this angle, you know how to come in, how to treat, or how to counsel patients. Then childless marriages, orphans, and motherless babies too, all these things pose contemporary problems in delivering healthcare effectively. Then we have the social adaptive process. This refers to how individuals and the societies adjust to changes, such as illnesses. You agree with me that illnesses comes with different changes, disability or aging. So these adaptive strategies include seeking medical care, changing lifestyles, and modifying social roles. It is very important to understand this. Then there's actually also a relationship between the social class and health status. There's a well-documented link between social class and health status. Individuals from lower socioeconomic backgrounds often have poorer health outcomes due to limited access to healthcare, unhealthy living conditions, exposure to contamination, the lack of food, and higher exposure to stress, stress to means ends mean to get food and the likes. So in conclusion, medical sociology as a whole provides a critical framework, like insight, to understand the intricate relationship between the society. So this is just an introductory class. It's really nice to have you around here. I would like to encourage you to ask your questions, your concerns, and as the concerns you had as the class was going on. You can put them down, you can send them to my mail, you can put them in the chat box, you can put it on the portal, and you'll be sure you have a result, an answer that will come right from me. Thank you very much. It was nice having you in class today. See you next time. Bye.